Ever wondered about the difference between congenital and hereditary problems? Well, you're not alone. So today here on the PD Pet Care Vlogs, we're going to talk about what the difference is between congenital and hereditary. I'm Dr. Cath Watson. Congenital problems are defects that are present at birth. So they are there immediately, they're obvious immediately. They can be caused by environmental factors, or they may actually be inherited. So some examples of congenital problems are things like umbilical hernias, or any hernias to be honest. So a hernia is just a bulge or a weakness of usually the abdominal wall, where some of those internal tissues are starting to push out. The most common one is an umbilical hernia, so that's where the umbilicus is attached to the puppy or kitten at birth. And that hole should close over, but in some cases it doesn't. Another good congenital example is something like a cleft palate. So that's where there is a fissure in the roof of the mouth that should have closed over, and depending on at what stage of the pregnancy the fetus has been affected, determines how big that hole or fissure is going to be. But that is present at birth. Hereditary problems, however, are always inherited from the genes that are acquired from the parents, and they may not be present at birth. However, in some cases they can be, hence the confusion between hereditary and congenital. So a defect may actually be congenital and hereditary, or it may just be congenital, so present at birth. But there are some hereditary problems that actually develop later in life. So while they've been inherited from the parents, they are present in the genes from birth, but those genes may not necessarily be expressed until later in life. So an example of that would be progressive retinal atrophy, which is a condition affecting the eyes of some breeds of dogs in particular. And it essentially causes an early onset blindness. However, those puppies are visual at birth and usually for the first few years of their life. It's an inherited disorder, not a congenital disorder. There are some disorders that can be present at birth, so congenital and hereditary. And some examples of that would be some heart disorders. So we get narrowing of some of the important arteries, the pulmonary artery or the aortic artery. So those arteries can be narrowed as a result of inherited genes, but will also be present at birth. So therefore they are congenital and hereditary. So hopefully that helps explain it. So just to recap, congenital is a defect that is present at birth and may be inherited or maybe due to environmental factors. Hereditary is acquired from the parents, so it's inherited from the parents, and it may or may not be present at birth. Those symptoms may develop later in life.